The following maintenance and cleaning procedures must be carried out by trained personnel. Before cleaning the mask, remove the filters and disassemble the mask. Please make sure to review the maintenance intervals stated in the IFU. Afterwards, check and clean the exhalation and inhalation valves. If the valves are deformed or damaged, they must be replaced. Otherwise, the valves may be reused. The mask body and head harness should be cleaned with an all-purpose detergent and rinsed in lukewarm water. For recommended detergent, see the IFU. In addition to the cleaning, a disinfecting should follow using the disinfectants listed in the IFU. Afterwards, rinse thoroughly in running water. After cleaning, press the valve disc into the valve seat, then reassemble the mask completely. When your equipment needs a quick clean, for example in training situations or during breaks, you can use an alcohol-free respirator wipe. Please note that this does not replace cleaning procedures described in the IFU. This cleaning method should only be used temporarily in situations where the mask is used by one individual.